I'm Tom Puckett. I'm the President and CEO of Bonfils Blood Center, and I want to welcome all of you to our 13th annual Community Lifelines program. This program is something that we started 13 years ago. We were the first organization and the first community in this country to do something like this. And it's an opportunity sometimes to put a face to that blood donation. People think that blood is just available and they take it for granted and what have you, but behind every one of those donations are some very, very special people. And we're going to talk to some of those today. I'm going to tell you a story today. It's a difficult story. It's a story with many characters, not the least of which is the star of the story, Dallas Armstrong, and her husband Billy. But it's also got a very happy ending, and we want to tell you this story so that you can see how the healthcare system in our community works together. Let me start by just giving you a little bit of background on Bonfils. Obviously, if you're here, you probably know a little bit about us to begin with, but we are 24/7, 365. We've been in this community now almost 70 years. It's been a wonderful partnership with the community and with the healthcare organizations that we're so proud to work with. We now are serving over 200 transfusion services around the country and primarily in Colorado. So it's a busy task, and but with the support of our community, we're up to it, and I appreciate that from all of you. We have a center out at the old Lowry Air Force Base, where all the blood that we collect throughout the state of Colorado comes in, and there we do all of the manufacturing aspects. The organization that you may have read about called the FDA, they think that just getting that unit of blood is not enough. It has to go through a manufacturing process before it can become a licensed transfusible product. And we do all of that at the Lowry building that we have. I hope many of you have come out there for some of your donations and the other activities. All the testing programs and what have you are out there. Most of the largest proportion of our employees are out there. We have 400 employees now spread all over the state of Colorado, collecting blood and working in the community to make sure that everybody that's eligible and has a desire to participate in a program like this have the opportunity to do it. When a unit of blood comes into Bonfils Blood Center, an average of 19 people touch that unit of blood as it goes through its process. But in the instance we're going to talk about today, I'm not so sure that there isn't anybody in our organization that wasn't involved at some level in the production of those units of blood that went up to Good Samaritan Hospital. In line with our mission, we're really pleased to have all of you here. What we do, our commitment to this community does not happen without the partnership of the community. Everything we do is wrapped around that activity. All of you that give us your wonderful support and the gifts of blood, and all the hospitals that work with us, make all of this system possible. So it is truly a community lifeline, and that's what I want you to take away from this activity, is that everything is a community lifeline, and there are lots of players in this activity. In December of 2010, Dallas saw her doctor after a period of feeling uncharacteristically weak and tired. And it was then that she was diagnosed with a rare blood disorder called thrombotic thrombocytopenic purpura. Now everybody should repeat that after me, please. I see a couple of transfusion medicine docs in the back. Maybe they can help you with that later. But what this disease is, it's really relatively uncommon, but it's a very aggressive disease that develops due to the absence or the lack of certain proteins that we normally see in a patient's blood, and it causes the blood to clot in all the small vessels throughout the body, and it makes, therefore, for a very low platelet count because all the platelets are associated with those clots. It's a very difficult disease to manage, but the technology has changed so much over time. It's going to play a major role in the story that you hear today. The medical professionals at Good Samaritan, and I'm always bad at this, but I should say Exempla Good Samaritan Medical Center. Did I do that right? I'm going to get the stairs from the third row back there. I can see right now. They have taken care of Dallas Armstrong. And throughout this treatment, she received nearly 650 blood products. She had, at times, 11 to 18 plasma exchanges a day. And in the meantime, throughout all this process, over a several-month period of time, she received units of blood as well. So Dallas, we're really thrilled to have you and your family join us today. I've had the opportunity to meet you and your husband, but I have not met the extended family, and this is great that they can all join us today in this celebration. I'd also like to welcome the staff from Exempla Good Samaritan Hospital as well. They play such a significant role in the relationship of getting these products from members of our community to the patients in need. And so I want to recognize the folks from Exempla Good Samaritan Medical Center. Gosh, David, I can't say these things. It's just too much. I also want to welcome David Ham. David is the president and CEO of the hospital and has been a friend and colleague of mine for probably more years than we want to count, but he has put together a team up there that provides extraordinary care to patients in need, and we are just honored to have a relationship with that hospital. And also I'd like to recognize the Bonfils employees that are here today too, because they play such a significant role, and not only in the life of Dallas and her family, but also in my life and in your life as well. We couldn't do what we do without the professionalism and training and education and programs that these people bring to us. And it's very important that we recognize all of the professionals that work in the healthcare system today. So I want to thank them for being here as well. On a day-to-day need, these hospital patients bring to us special opportunity to bring our community together. And through the teamwork and dedication and really the shared vision of all of the people involved in these programs, we're able to have good outcomes. And we're able to have the kind of systems in our community that we need to care for our community. So I really want to emphasize that. The blood donors, I mean, there's 75 to 100,000 volunteers that come to Bonfils every year to give of themselves so that they can help someone else. We couldn't do this program, obviously, without them. And if you stop and think about the altruism that's involved in donating blood, these are very special people. And we have a few of those with us today as well, and we're going to talk about that. But before we move on to hear from our featured guest, I really want to formally introduce David Ham. David is the president and CEO of Exempla Good Samaritan Medical Center, where Dallas was diagnosed and treated, and spent a period of almost 4 months in the hospital up there. David brings to Exempla a phenomenal history of hospital executive leadership and guidance. And if you've never been up to Good Samaritan Hospital, Medical Center, it is an extraordinary facility on an extraordinary campus with extraordinary people doing the work that they do. So before I go further into this, I would like to introduce David Ham.
Thank you for those kind words, Tom. That makes me redo my speech because I was going to tell stories about Tom. But after that really very, very kind introduction, I think I got to stick to the good stuff. Tom and I have known each other a long time, and this is not the first of these events I've been to. It's the first time I've been able to be in this sort of spot to be honored, and I am honored to be here and honored to have a role. We are part of, Good Samaritan's part of Exempla. We are 3 hospitals in Denver, St. Joseph, and Lutheran. And so some of what I say could apply to all 3 of our hospitals. But more importantly, I think some of what I'm going to say could apply to any number of hospitals, perhaps all across the state. And so in some ways, I stand here before you not just representing Exempla, but representing all hospitals. We are very blessed to have in our state a wonderful organization, Bonfils, who does a terrific job in helping us have the products that we need to care for our patients. Before Good Samaritan was built 7 years ago, I was part of St. Joseph and then part of St. Joseph and Lutheran, And I can remember meeting Tom clear back in those days at St. Joe's, making sure that we had everything worked out to make sure our patients received good care. Bonfils not only does a great job of bringing blood products to our hospital every day, they partner with the community. So Tom talked about the 19 people that touch every product. So Bonfils serves as a reference lab for our lab to make sure that we have the sophisticated testing available to us that we need. There's wonderful teaching, community education and teaching in our hospital and for our community that they provide. And then most of all, they provide safe products for our patients. Dallas has an amazing story, and I don't want to take too many minutes because I think she is the star attraction today. But the reason that we're all here, I think, is because of you who are donors. So we could not do any of this, take care of patients, in our case, collect blood products, in Tom and his organization's case, if it weren't for people that, as Tom said, are willing to give of themselves. It is a gift of life. There's not artificial products yet. Maybe some future time there will be. But as of where we are today, there is no substitute that we know of for you all being willing to give yourselves. So thank you for being a donor, if you are. And if you're one of us who then receives the benefit of that downstream, thank you very much for that. Tom, thanks very much.
Thank you, David. Now it's time for you to hear from one woman who all of you here today have some connection to in one way or another. As I said, this is kind of a play, and there has to be a main character in a play. And we have that character with us today. So would you please welcome to the podium Dallas Armstrong.
Hi. First of all, of course, I want to thank everybody for coming today. And I'm very nervous to meet people, and I realize I shouldn't be because now you're a part of me. So this is great. Hey, where's my reason for living? Oh, there he is. Hi, Gavin. Hi. I haven't really written down a lot about what happened to me. It was traumatic, and to be honest with you, a lot of it is blurry. But I did want to probably have to read what I have to say. And that is this. We have all heard the saying that it takes a village to raise a child. This last year taught me that oftentimes it takes village upon village upon village to save a life. In December of last year, I suddenly found myself at the mercy of a rare blood disease that knows no mercy and whose name I cannot pronounce. I think everybody has problems with it, so it is more commonly known as TTP. From my hometown on the Eastern Plains to Denver, where I lived and worked for many years, to Good Samaritan in Lafayette, Colorado, to my home in the Rocky Mountains, Estes Park, to an assisted living center in Longmont, these villages all merged together. Kaiser Permanente and their various clinics played important roles and continue to do so. These villages came together to help me live. I was at Good Sam's for so long that I was able to get to know a lot of folks who took care of me. The chaplain, doctors, nurses, CNAs, maintenance workers, volunteers, kitchen staff, and the people who came every day to give me the plasma I required to continue to live. It is difficult for me to recall everyone's names, but I can assure you that I do recall everyone's faces and how they reached out in their own way to help, to comfort me, and to give me not only their professional skills, but their friendship. I think of them every day and wish only the best for each and every one of them. You have a great hospital, sir. You really do. I want to say thank you to my family, my husband Billy, Benny, Ayana, and my grandson Gavin James. my niece, Dawn Renee, and her family, my Aunt Barbara, who lives in Lafayette and was only about 10 minutes away, cousins, and several of my best friends forever who I consider family. It seems like I hardly open my eyes to not find someone there or on the phone checking on me. Today is for focusing on yet another village. This village is the one behind the scenes. This village gave and then sent 11 to 18 units of plasma to Good Sam's every day, especially for me. This village literally gives of themselves to save a life, which happened this time to be mine. This village does this day in and day out for those who would not live without their awareness and their generosity. It is no surprise that I and those who love me are extremely grateful to Bonfils and to donors who give their blood, more often than not to a complete stranger, simply because it is needed, simply to save a life, and simply because it is the right and decent thing to do. Today I am humbled and I am honored to meet some of my donors. In my heart, I will hold a picture of each and every person who helped me to survive. Together, these pictures will form a mosaic of my very own and my very personal amazing grace. You are all my amazing grace. I hope to never forget to live my life for all of you to the fullest. I recognize this as my responsibility, my way of paying a debt to all of you, and the only way to truly say thank you. Thank you.
Look at that. You okay there?
Thank you for helping my grandma.
Sharing stories like this are not easy. They're so personal and they're so emotional that every time that we go through one of these programs and we meet a family and work with a family over a period of time, it brings a tear to all of our eyes, and it makes what we do worthwhile. And so Dallas, thank you very, very much for sharing your story with us today. The balloons behind me here represent the 326 donors that Dallas had during her hospital stay. The blue balloon represents Dallas. So you can get an idea of the perspective of that village and how they have to come together to do what we did today and over the last several months. Today we have over 50 of Dallas's donors with us. And I'm going to call each of them up by name, and they'll have the opportunity to meet Dallas here, and then go back to your chair and behave yourselves. And then at the end of the program, there'll be some opportunities for some photographs and some other things for all of you as well. So when I call your name, if you would, please come up and meet Dallas. This must be like almost a high school graduation with all these people here. So we're going to start with Michael Ennecker. Stephen Billick. And Michael Bagley. And Ken Barrett. Stanley Barker. You better hold on to this one. Yeah. Jim Bells. Joe Black. And William Bunker. Mitch Castor. Tim Clifford. Patrick Delap. Barbara Dolan. Thomas Donahue. And Stephen Canges. Michael Camelli. Cheryl Duncan. Tony Durr. Edward Duncan. And Kevin Evans.
Oh, thank you.
Iris Fleming. Clark Fulmer. Norman Fast. Jeffrey Geller. Keith Hart. Gregory Hopman. Linda Heinz. Constance Cordes. Richard Johnson. Tom Pryor. And Robert Nibbs. Charles Krimenecker. And John Levine. Jason Lind. Michael Lutre. And Willis Mangia. Sandra Monahan. Marvin Montgomery. Priscilla Mortens. Charlene Orr Webb. And Bob Padboy. Michael Pinnell. John Porras. Anthony Pernitis. Nicholas Pappy. Verena Rogie. And Christopher Ross. George Sandoval. Kevin Schneider. I have to slow down here. This is like reading the honor roll here, you know. Hopefully I haven't butchered too many names so far. I still have a few to go. But I wanted you to know with all the donors that we have here today, not one of them was named Smith. Now figure that out. Jonathan Sterner. And Clinton Smythe. Ivan Tuma. And Cindy Warner. David Winkler. Terry Yanan. Christine Orr. And James McKinney. Now there's a happy ending. thank all of you. I want to thank Dallas, Billy, your family, David, all of our special guests today to make this a special program. A big thank you to all of our donors and all the employees of Exempla, Good Samaritan Medical Center, and Bonfils Blood Center. I thank you. I could say the last one. I can't get that first one down. I would like to have all of the blood donors come up to the front here and have the opportunity to, we'll facilitate some photographs with Dallas and probably some of her family, at least not of which a grandson or two maybe. But I invite the rest of you to please stay and enjoy some cake and refreshments outside. I thank you all for making this a very special day for us, and thank you for being part of our family. Good day.